having a lot today. I don't know exactly how many today, but probably close to 2,000. So probably 4,000 second doses.
Okay, thank you.
Today's the start of our biggest day, at least in December. And tomorrow is going to be a big day. And then Friday will be dead. We'll still be open, but Friday will be dead because it wasn't open Friday 28 days ago.
Okay,
Right,
we'll go ahead and get started now, guys. Media is in attendance. This is David Henry. I'm Communications Manager for the City of Amarillo. Let me welcome everyone to the weekly news conference for the latest in COVID-19 information for the community. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas, Dr. Michael Lamintier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We will open it up to statements from our panel members, and then we'll take questions from our media members. We'll start with Amarillo Mayor Ginger Nelson.
Thank you, Dave. Good morning, Amarillo. Amarillo's been in the news. We've had our name in the national headlines in the last few days for leading the nation in getting vaccinations out to our citizens. That's a fantastic headline. We've had some headlines related to coronavirus that weren't fantastic. And so it's wonderful to be leading the nation in executing and getting our vaccination clinic up and getting as many people as possible vaccinated in the short period of time that vaccines have been available. So a gigantic shout out and pat on the back, standing ovation, round of applause, all of those things to our public health clinic and all of the people that have worked there. I will call out the health department employees. They've done a fantastic job, but it's been such a large partnership. 9 or 10 different city departments have worked in that clinic, as well as, of course, it's all happening under the leadership of our Public Health Authority, Dr. Scott Milton, and all of our other medical community, many of which are represented here on this call. So on behalf of the citizens, guys, I want to say thank you. And I want to say what a great job you've done in vaccinating. Who are the people getting vaccines? I think is something I'm getting a lot of questions about. We've vaccinated over 24,000 people, and roughly 85% of those people live in Potter and Randall County. So mostly we're vaccinating the people right here in our own health district. Another 11% come from the greater Panhandle area, which doesn't surprise us at all. And then 4% of the people vaccinated in those numbers are outside our general Panhandle area. So I think that's interesting, and you might be curious as to who's coming to the clinic to get vaccinated. We are asking that if you are qualified either in the 1A category or the 1B category, please come and get a vaccine. It's good for you. It's safe for you. And most, also a second point is that it's good for our city. It keeps all of us safe when we increase the number of people who are vaccinated. So my parents came yesterday and got their second vaccine, and I am thrilled. We went out to dinner last night and had a little toast to the vaccine. So I hope if you're in that category, you will consider coming down to the clinic, getting your vaccine and making yourself and our city safer against the COVID virus. Thank you, Dave. That's that's all I have this morning.
Thank you, Mayor. Let's now go to Public Health Director Casey Stoughton. Casey, how are you this morning?
I'm good, Dave. I did just have a little panic. My computer froze, and so I didn't have the data to share, but it's back up, and so that is good. So it's always good to have a little bit of a quick heartbeat right before you start talking. So anyway, so as of yesterday, we had a total of 31,880 total cases of COVID-19 here in Potter and Randall counties. We have a total of 16,308 cases in Potter County and 15,572 cases in Randall County. We do have a total of 24,403 recoveries, and we're thrilled about each and every recovery. We are up to 591 deaths here in our community, and we're just heartbroken at each and every death. It's absolutely tragic. That leaves us with 2,886 active cases. Each of the cases do represent a unique individual. The rolling 7-day positivity average for the Potter and Randall counties is down to 8%, and the positivity rate at the drive-through testing site remains around 33%. The 5-day new positive case average is at 132 new cases per day, and so we're certainly trending in the right direction. The GA32's hospitalization rate for the 25 county Panhandle RAC region has been over that 15% threshold that's outlined by the governor for over 3 months now. I think Dr. Gonzalez said earlier this week that we had passed the 100-day mark. And so certainly not a milestone that we wanted to pass, but one that we are certainly trending down towards. And so we're certainly making progress on. So that Panhandle RAC percentage rate yesterday was at 17.06%. That means that just over 17% of all of our hospitalized patients have COVID-19. Locally, we're still in status level red. And while our numbers are trending in the right direction, it's up to all of us as a community to continue that fight against COVID-19, wearing our masks, washing our hands, socially distancing, and staying home if we're sick are just those tools that we have in our toolbox against the fight against COVID. As far as public health operations go, we have several operations still underway. We have the public health drive-through does remain operational. You can call 378-6300 to be screened and directed to the test site. The BAM Livanivimab Outpatient Infusion Center is operational. And so we're serving patients through a referral from their physician's office. And so any patient that meets that EUA criteria, we certainly want to receive that referral. So we've seen 103 patients so far, and only 3 have required hospitalization. So a great success rate with that medication there. On the vaccine front, the Civic Center is certainly hopping today with patients, and we are thrilled to be giving vaccine and lots of it today. As of yesterday, we had received we have 28,000 first doses that we have received so far and 10,000 second doses. We've given just over 27,250 doses, total doses. So we started the morning off with 1,700 first doses and just over 9,000 second doses. And so if you're in that 1A or 1B category and you haven't received your vaccine yet, please come see us. We're giving vaccine to people in those 2 categories, anybody over the age of 65 or have a chronic healthcare condition, or if you're a frontline healthcare worker, please come see us. Or if you've had your vaccine, your COVID vaccine, you got that at the Civic Center, anytime on or before December 30th, now's your time for your second dose. Stay tuned to AmarilloAlerts.com. We have a new feature there. We have a date checker. And so that's really helpful. So you can take a look at your card. Taylor's pulling that up on the screen now. So you can see we have availability of first doses in Group 1A, availability of vaccine for first doses in Group 1B, and then second doses in all groups available. So it's helpful to check that every day before you might come to the Civic Center for your vaccine, but also check that date checker. So take a look at your card and make sure that your date on your card is on or before the date that's there on that date checker. So if you got your shot on or before December 30th, come down and see us at the Civic Center. The other thing that's important is our communications team has made a flyer, and that flyer is going to go in all of the water bills. And so you'll be receiving a flyer that looks like this. And so go ahead and put that on your refrigerator. And if a friend asks you a question about the vaccine or about clinic times or about COVID-19, go ahead and direct them to AmarilloAlerts.com. We're happy to answer any questions there that we can. And one more reminder, the little card that you get when you got your first dose, bring that back for your second dose. It'll be your official shot record for your COVID-19 vaccine, but it'll also make your time with us at the Civic Center shorter. And while I know you love to come to the Civic Center and get your vaccine, you do want to spend as little time here as possible with us. I do have some statistics about the vaccine. So we have some breakdown of the data that we've been collecting, and I did promise that last week, and so our team was able to pull that together. And like Mayor Nelson said, just around 85%. So the exact number is 83.3% of the total of all of the vaccine that we've given at the Civic Center has been given to patients in Potter and Randall County. So 16.5% of the vaccine has been given to patients outside of Potter and Randall County. The breakdown between male and female, so it's always good to have a healthy competition, but right now, female, we're winning, girls, so congratulations. 53.5% of the vaccine has been given to female and 45.2% of the vaccine to men, so that's the breakdown there. Our breakdown racially is 85.7% of the vaccine has been given to folks who indicate that they're white, 2.7% to people who indicate that they're Black, 4.2% to people who indicate that they're Asian, 15.8% to people who indicate that they're Hispanic, and then 3.7% who indicate that they're in an other category. And so we welcome everyone. We do ask just to look at people's IDs, but you don't have to have one. So if you don't have an identification, if you've lost it or you don't have one, that's okay. Come see us. We want to make sure that we're vaccinating people in that 1A and 1B category. And I think that's all I have today, Dave. Thank you so much.
Thank you, Casey.
Hey, can I jump in and add something at the end of Casey's remarks? The communications department has done a fantastic job putting out information about the vaccine clinic. And a lot of their communications have been in other languages. So we had a whole social media push where we bought ads on Facebook in different languages, pushed out to different zip codes across the city that we thought spoke those languages. So in addition to the utility billing insert that every utility customer is going to get about the vaccines, we've been very intentional about trying to communicate to people all across the city in all different neighborhoods, all different demographics, people who speak different languages. And of course, our website is available in multiple different languages too, and has that same information. But I wanted citizens to know that we want every single resident in our city to get vaccinated. It does not cost anything. If you need a ride to come and get a vaccine, you can call 378-3095 and the city will give you a ride at no cost. Casey is correct that you do not have to be a citizen in order to get a vaccine. If you're here living in our city, your health is important to us and we want you to be safe. So we don't check for immigration or citizenship or anything like that. I just want to be really clear. These vaccines, what we're focused on here in the city is everyone's health. And if you're in our city, we're concerned about your health. So we're trying as hard as we can to communicate to all different ethnic groups and neighborhoods in our city. If you have an idea on how we can improve that communication, I hope you would let us know that. And you can email us at publiccommunications@amarillo.gov. Thanks, Dave.
Thank you, Mayor. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm good. Thank you, Dave. So those were great synopsis of what's going on in our community, and our numbers are clearly better. And they're better really for three separate reasons. It's because we're continuing to wear masks, and we need to remember to stay vigilant about that, because that is the most important way to mitigate the spread of this contagious virus. Then certainly, I think that our vaccinations are starting to have an impact. And finally, because there have been a significant number of people, unfortunately, who have become infected and recovered. So I think that the combination of those things drives our numbers down in the hospital, and that's what we want to see. So please stay vigilant with masks. Also wanted to let everyone know that at the Health Science Center at Texas Tech, they will be giving second doses today until 7 p.m. So, but only for those who got their first doses with Texas Tech. And there you can go to the texastechphysicians.com website for that has a schedule for the vaccine. Just briefly, in the media, there's been a lot of coverage about the variants. There's been no evidence to date that shows that the vaccines are not effective for these variants. What has been shown is that these variants are more contagious. And so that reemphasizes how important it is to get vaccinated. So it really is a race against time. So once again, I would encourage everybody to get vaccinated when appropriate, when it's your time. So let's keep doing that. Let's stay vigilant, and I'll look forward to hearing to the other three doctors about the hospitals.
Thank you, Dr. Milton. Now go Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you today?
Good morning, Dave. So I am actually very impressed about how effective these vaccines are at generating antibodies against COVID. So just to remind you, the previous vaccines before these, what scientists or companies would do is they would disable the virus from reproducing and inject the virus into our body so we get that response against the virus. These vaccines are new technology. So what the Pfizer and Moderna are doing is the vaccine is teaching my body or giving my body the message on how to make one of the proteins on this vaccine surface that my immune system will then recognize afterwards. I'm about 2 weeks out since my second shot, and a number of us that got shots around the same time decided to do the experiment and say, do we have antibodies? So we went to our lab, and so the test that we use to look at antibodies, if you get a score of 1 or greater, that means you have antibodies present. Well, when I checked my antibodies, the first one was the IgM. The IgM is that quick response antibody that we get, what our bodies generate first. Mine was 14. So it needed to be 1 to be positive. Mine was 14. But even more encouraging was the IgG. The IgG is the long-term antibody that our body makes. My IgG level was 36. Okay, so I had a very robust response to this vaccine. And in fact, all my colleagues that also did this had the exact same response to this Pfizer vaccine. And the Pfizer and Moderna vaccines are similar, not identical technology. So this is huge. This tells us these vaccines are very effective in allowing our immune system to recognize this protein on this virus and be able to respond to it. Now, the important thing to remember, though, is just because I know I'm full of antibodies doesn't change what I'm doing to protect myself and other people around me. Okay, so I will continue to wear a mask. I will continue to keep my distance, okay, until all of us are immunized and this vaccine, the reproduction dies off, like Dr. Milton was talking about. We must continue to protect ourselves the way we have been. But I'm very encouraged with these vaccines. Let's talk about the numbers at Northwest. We have 51 positive patients in the hospital today. Again, that's the lowest number we've had since the first week of October. Now, just to remind you, we went from the beginning of October to the second week in November, we had the highest number in the hospital. We have 130 plus COVID patients. So here from the second week in November, we've continued this descent down in terms of the numbers. So right now we're at 10.3% of our licensed beds being COVID. And that's the number, that's the percentage that the governor wants us to keep our eye on. Now, so right now we have 56 individuals in our ICU, 22 of which are COVID patients. And we're using 19 of our 61 ventilators, and 9 of those ventilators are being used for patients with COVID. In terms of our positivity rate, our outpatient testing, yesterday we had a 6% positivity rate. That's fantastic. We've been below 10% consistently for almost 2 weeks now. So that is really encouraging, because that translates into hopefully less admissions to the hospital. Unfortunately, we have 49 people that lost their lives to COVID in January. I mean, it's better than it was in November and December, where we lost 70 plus individuals, but still 49 is way too high. But hopefully we will continue to make progress on that. With regard to remdesivir, the drug that we use in the hospital with Decadron, we have treated 695 patients with that medication, and currently we have 9 patients on the drug right now. The bamlanivimab, that's the outpatient monoclonal antibody that we're working with the city on. We're aware of 155 doses that came from Northwest being given to people. We have about 250 doses left. So again, for those people who go to their providers and they qualify for this antibody, under the EUA, we want to see them to receive this antibody if they qualify for it. We talk about the nursing staff. Right now, we have about 140 traveling RAC nurses still working at Northwest, and they've done a great job for us. But certainly, as these numbers come down for COVID, we are expecting this nursing staff to be redeployed to other places in more need. So right now, we're working on trying to reestablish our employed nursing staff to be able to replace those nurses that have traveled to help us over the last couple months. And finally, as these numbers come down, I hope we'll start to see things return slowly to normal. One thing I like to do is I like to see us put our furniture back in the front lobby. And we're even talking about maybe opening up an entrance here or there more than we have right now. So the good news is this is encouraging. We're excited about getting back to normal to some semblance. But until then, we must keep our guard up. We must protect ourselves, just to keep the numbers from going back up again. That's all I have today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamintier, Chief Medical Officer for BSA. Dr. Lamintier, how are you?
I'm good, David. Thank you for the introduction, and good morning, everyone. I'd like to start off today with just a quick vignette about what we had at BSA with a leadership meeting this morning. And I was presenting some information to our leaders at BSA. And there's an article that I was reading recently that was a kind of what we see oftentimes at the end of the year, a summary of the most pertinent articles that occurred or that were reported in 2020. And really, this was demonstrating to everyone the amount of significant loss that we've suffered in 2020. And it was actually a link that you could go to that had by name alphabetized all of the healthcare workers, no matter what role they were in, but had some affiliation with the healthcare environment, who lost their lives to COVID-19 in 2020. And this was across the world. So all countries, all races, all creeds. And as you start to scroll through this list, I have to say it was overwhelming. I was starting to get a little bit, choked up about it, because just you realize how many people have succumbed to this virus. And then you think about the people that that are coworkers that you've known throughout your life, that are in different parts of the country, perhaps different parts of the world, and what this virus has done to us this past year. And then the amount of individuals who are trying to help individuals cope with this illness and treat them, who have, again, lost their lives. So 2020 was a difficult year, but we have a lot to be positive about, I think, for 2021. And that starts with the number of vaccinations that we have available to help combat this virus. It's also evident by the outstanding effort that has been produced by our leaders in this community and our healthcare workers in this community, and the folks that are helping us vaccinate so many individuals at the city location, in addition to the other sites across our city where we're providing vaccinations. These are the things that we can do to make sure that 2021 is a better year. It was reported this week that we've had the greatest number of deaths in the United States in the month of January than any month to date. We surpassed December by over 1,000 deaths. So this race is not over against this virus. This battle is not over. It is only at the point where we know that we now have some better tools to combat it, and we need to continue to be vigilant with our efforts to mitigate the virus. So again, I think that this is a little bit of a word of caution, that we need to be cautiously optimistic about where we are, but let's not think that we are past the potentially most difficult part of this battle. We are very much similar to Northwest now in terms of the numbers declining since about the late aspect of, or late portion of November, I should say. We are currently today at 64 total patients here hospitalized with COVID-19 at BSA. We have not been that low at BSA since October the 5th, which I think is identical to what Dr. Weiss said as far as the last time they were that low with their census at Northwest. I think that's interesting when you look at the parallel between both facilities in our city in terms of the decline in positivity and hospitalizations. Our trauma service area numbers continue to get better. And at BSA, as far as our licensed beds are concerned, we're at 14% of our licensed beds are now occupied by COVID, which is below that 15% threshold. If you look at our actual census, the COVID patients make up 19% of our actual total hospital census right now. For ICU stats, we have 68 total ICU patients, which is still a high burden of intensive care patients at BSA. 28 of those are COVID-19 patients, and 50% of those COVID-19 patients are on the ventilator currently. We do currently have a lot of ventilator capacity with the additional supplies that we brought in over the past year. Some of those being vents that were supplied to us by the RAC, which we're very grateful for. But we certainly have more capacity there as we see the census dwindling with COVID admissions. Our non-COVID patient population is rising. So we still have a census over 300 at BSA, and it's been holding in that range because we're seeing more patients come in with acute illness that is not COVID related. The good news there is that we have more capacity to manage those individuals that need to be hospitalized for their illnesses. And hopefully, as we see the COVID numbers continue to drop, we're going to have more ability to manage individuals that have chronic illnesses and acute flares that we need to treat aggressively. Our testing numbers are also down in January month to date. We're at 14% of all tests showing positivity. That's both on the BSA hospital side and on the outpatient clinic side where we do testing. And that's down from about 17% in December. And as we've said several times, down from about 34% in November, when our numbers really were peaking in terms of positive rates with all the testing that was being performed. So again, I think I'd like to finish by saying another thank you to all of the healthcare workers, no matter what your role is, in terms of what you've done to sacrifice and care for our patients from the beginning of this pandemic in our area in 2020 through today. And we have not forgotten about those individuals that have lost their lives to COVID-19, and we can't forget about those, and not just healthcare workers, but everyone that has lost their life to this horrible disease. But I do feel like we have a good future ahead of us with vaccinations, with additional therapies, and teamwork to help us do the right things for our community to make sure that we're giving everybody the best benefit of the doubt when it comes to battling this pandemic. So thank you. That's my update for today.
Thank you, Dr. Lamintier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Excuse me. Dr. Gonzalez, how are you?
Doing well, David. Thank you. So first of all, I just wanted to say what a great job the Amarillo community is doing. The public health department in setting up the vaccination clinic at the Civic Center, and then the community actually going in and getting vaccinated. When I got to hear how well we were doing as a community compared to others, absolutely honored to be here. And I'll say, since we do have our clinic in Lubbock, they are just a short bit behind the Potter and Randall area. In fact, I looked up today on that website that was cited in the feature article, and Potter, Randall, and Lubbock were the number 1, 2, and 3 metro counties in the nation for vaccination efforts. And so very happy to hear that. So our COVID patients in the hospital, we were at 4. We have 2 in the ICU. I don't know exactly when we were last at that, but I would bet if I were to go back and check, it would also be around that October time period, that early October. And so I think we're just seeing that similar story. Both the other hospitals mentioned, their percentage of their beds, that's about 14% of our beds. So definitely right in the same area. Now, we continue to vaccinate here at the Amarillo VA and our Lubbock clinic. We vaccinated over 2,500 total. That's about 1,900 veterans. The rest were staff. And that represents about 10% of our veterans that we take care of. And so we continue to make that vaccine available. We have about 400 doses on hand when we started today. But I'm going to tell you one thing that I noticed yesterday and Monday. Not all of the appointments we had set up for the vaccine had gotten filled. And so I'm just going to encourage veterans to please call. If you want to get vaccinated, please call, let us know, and we'll see if something's available. In some cases, we've been able to offer it to veterans who came in for appointments for other reasons, and we've asked them, do you want to get vaccinated, and been able to get them vaccinated. So we want to get this vaccine out. The vaccine on the shelf in our pharmacy is doing nothing for our community. And so we want to get it into the arms of those willing to receive it. So if you're a veteran and are interested in getting the vaccine, please call us and let us know, and we're going to see if we can get you in as soon as possible. Tomorrow, I'm going to be hosting a telephone town hall with our veterans. We plan to call about 15,000 veterans. We're going to open it up to anything. I know obviously the discussion will be a lot around the COVID and the COVID vaccine, but looking forward to that conversation. Dr. Lamintier just spoke about the people we've lost to COVID. And just interesting, this Friday, our chaplains are putting on a virtual event, a last roll call for veterans that we've lost over the last 6-9 months. Now, it's not all COVID. It's something that we do regularly, but it had to be put on hold due to COVID. So we can't do it in person like we've typically done with these families. We're going to do it virtual. It'll be out there on Facebook Live, and it'll be saved on Facebook. So families who can't watch it at the time it goes on Friday at 2 p.m., they'll be able to view it later. But for those that want to, I just want to make sure we tell you. Another thing I just wanted to bring up is I did some quick math in my head. And if I added correctly, our 3 hospitals are at 119 COVID patients. Now, why is that important or anything? Is because I think it was back in July when we started to see a little increase. Dr. Lamintier had made a message right before going on to me, look forward to here, because we are almost at 100 cases of COVID in the hospital. And we saw that as worrisome. And why do I say this? Is because, we tend to be very happy. We're on this downward trend, but we cannot let up our guard. We have to continue wearing our masks. We have to continue to practice our social distancing. If we're ill, we should stay home. Practice good hand hygiene. Those things continue to be important. And so I don't want us thinking that, hey, it's over. I got my vaccine. I got my 2 doses. I've got that immunity that Dr. Weiss talked about earlier. We still need to practice that guard. And finally, the last thing I want to say is I want to give a shout out and a big thanks to all of our Vietnam veterans. Those of you may know today represents the 48th anniversary of signing of the Vietnam Peace Agreement. And, when I came back from Iraq in 2003, when I came through those airports, whether it was one I was transiting through or my final destination, I was thanked. I had many people come up and want to shake my hands. Our Vietnam veterans, almost all of them, many of them did not get that same welcome home. And so if you are a Vietnam veteran, I want to just thank you for what you did for our service, whether you were drafted or you volunteered and signed up. We really appreciate that service. And if you know a Vietnam veteran, I encourage you to really reach out to them and just thank them for their service. And that's all I have. And thank you again for the city of Amarillo for this opportunity.
Thank you, Dr. Gonzalez. Let's now go to the city manager, Jared Miller. Mr. Miller, how are you?
Good. Thank you, Dave. Just want to remind everyone that the Amarillo Public Health is still conducting COVID-19 testing at the drive-through testing center. If you have symptoms you feel might be coronavirus, please call Amarillo Public Health at 378-6300. They're going to assess you on the phone. They're going to refer you to the drive-through testing center. We're also doing, as everyone has said, vaccinations. We're moving very good over there. We're moving a lot of people through there. You're not going to have to wait very long. If you feel like you want to if you're in groups 1A and 1B, I can't encourage you enough to go out and get your vaccination. We're doing it all day today and throughout the rest of the week. We want to make sure that if you don't have a means of transportation, as the mayor said, call Amarillo City Transit. And we're going to get you to the testing site and to the vaccination site for free. Please call 378-3095, and we're going to schedule your trip there and your trip back. So we want to make sure that there's no barriers to getting that test, to getting that vaccination, making sure that we're protecting our community as much as we can. We're still operating under the governor's executive orders, GA-29 and GA-32. GA-29 requires that we wear face coverings when we're out and about. I'm so proud of our community. When I go out and about and I see the compliance, when I see people caring about the people that they're working with, the people that they're working for, the people that they're interacting with when they're in stores and other places, the level of mask wearing is impressive. And that's what's gotten us to this point through this very challenging period that we're just on the cusp of coming out of. We're not out of it. And there's never going to be a time, at least not in the near future, where we can relax our guard and relax our vigilance. We've got to keep wearing those face coverings. So I want to encourage you, just like all the doctors and medical professionals on this call have done. That's all I have, Dave.
Thank you, Jared. We're now going to open up the questions from our media members. If you have a question for an individual member of the panel or the panel as a whole, that's completely fine. Let's go ahead and start with, and I apologize in advance if I mispronounce your last name, Penny Commit. Did I pronounce that correctly? Channel 10. Penny, how are you this morning? Good morning, Penny. Penny Commit of Channel 10. If you have a question, you may go ahead and ask it now. We will come back to Penny. Let's go ahead and go to Dalton Williams of Channel 7. Dalton, how are you today?
I'm good. Thank you for having me today. So my first question is, we're hearing a lot in the media, this kind of buzzword of herd immunity. So my first question is for either Casey or the doctors, is herd immunity even possible for our community?
Yes, it is, herd immunity, but we'll have to vaccinate a lot of people in order to achieve that herd immunity. And that's certainly a public health word. My public health heart is warmed when we are saying words like socially distance and herd immunity. And so those are words that are very much public health words. And so, but we have to have a lot of people vaccinated. And one of the doctors may chime in on what that number looks like. But when we talk about like measles or another disease, we have to have 80 to 90% of our population vaccinated against that disease to have what's called herd immunity. And that means that everybody in the population is either vaccinated or protected by someone who is vaccinated. And so that's why we want to make sure that we're protecting each other by either being vaccinated or by being, kind of with someone who is vaccinated. And so we wearing our masks, being socially distanced, washing our hands, staying home when we're sick, all of those things protect each other. And so right now we're well on our way. If the COVID Act Now website says that we have vaccinated about 11% of our population, that's not enough to achieve herd immunity, but we're certainly working towards that. And so we're going to keep working towards that until we get there.
Okay, and then that was kind of going to be my follow-up question is, do any of the doctors kind of have a rough estimate of the number of vaccinations that we have to reach to achieve this herd immunity?
I think that it's hard to predict how many vaccinations that you need to achieve herd immunity, because that number also includes those that have been infected and have recovered. As Casey alluded to, with measles, that's the most contagious infectious disease that we know of. And herd immunity is probably greater than 90%, maybe 95% of the population has to be vaccinated or in order to achieve herd immunity. There's been a lot of discussion about what is the number for this virus, and those numbers have varied somewhere between 60 and I've seen as high as 80% in order to achieve herd immunity. So it's a combination of both those being vaccinated and those who have been infected already. Obviously, what we want is for people to get vaccinated, because the risk of getting infected is enough to where we still have a lot of people that are in the hospitals, far too many deaths.
Okay, and then kind of moving on to those who are getting their second dose. For those that are a little concerned about getting that second dose of vaccine because they may have experienced some severe side effects from the first one, they're like, maybe I'm good enough right now. Can y'all just kind of stress how important it is to get that second dose of the vaccine?
Well, once again, the recommendations are that people receive 2 different doses for these 2 types of vaccines from both the Pfizer and the Moderna. And the reason that you do that is because you achieve a much better immune response after the second dose. you achieve some benefit, I think, from getting one dose, but it's that second dose that really offers the better immunity. And it looks like the studies have shown that both these vaccines are about 95% effective in terms of achieving immunity. So once again, it's very important to get your second dose.
Okay, and then my final question is, for the second doses, how are those supplies standing? Are we still in pretty good standing for those that need to get that second dose?
Yeah, so we're receiving our allocations for the second doses for everybody who received their first dose. And so we certainly have our supply for the second doses.
Okay, awesome. Thank you so much. That's all the questions that I had today.
Thank you, Dalton. Let's now go to David Gay of Amarillo Globe News. David, how are you this morning?
I'm good. Good morning, everybody. If my math is correct, I believe Tuesday was like Casey referenced, the 101st day trauma service area A has been above the 15% COVID-19 hospitalization rate. While it is at 17%, the area hasn't quite hit that 15% mark. What needs to happen to continue that decrease? Because it seems like to me that it's kind of flattened at that between the 16.5 and the 17.5 mark in the last few days.
Dave, that's a great question. I think we're going to have to really, dig down deep and continue to wear our masks. We've got to stay socially distant. It's really easy to want to, have those get-togethers and have those birthday parties and, go to weddings and different things like that. But if you're sick, you've got to stay home. Even if you think you may have allergies, you've got to stay home. All of the things that we've talked about since March, or even before, just really have to dig down deep and continue that march towards the fight against COVID, and hand washing and socially distancing and staying home and wearing masks and just kind of stepping back. If somebody's close, just step back and put that distance between each other, and don't wait too long to go to the hospital. I think that's just another piece. Don't wait too long to seek medical attention. I think that's important too.
Absolutely. And I know that the major hospitals and or representatives from the major hospitals and trauma service area A are represented on this call. And I believe Dr. Weiss said about 10% of the licensed beds are COVID, and at BSA around 14. Is there any, other area in trauma service area A that's keeping that number above the 15%? Do we know any information about that?
David, I would say, so you're also talking about a lot of these smaller regional facilities, and because they have a low number of beds, every COVID patient they have is going to change that percentage, obviously much more drastically than it would at BSA or Northwest. So I think that's where we're seeing some of those higher percentages, is these smaller facilities where, if they have 6 beds and 2 of them are filled with COVID patients, you got a 30% rate right there. So I think that's it's just part of a numbers game in that sense.
Absolutely. Thank you for the clarification, Dr. Weiss. That's all the questions I have. Have a good rest of your week, y'all.
Thank you, David. Let's now go to, if I'm not mistaken, Aaron Langston, KAMR Channel 4. Aaron, how are you today?
Hello, how are y'all?
Good.
All right. First question is, has there been any indication as to when the next group for the vaccine might become available, the group after 1B?
So I know the state, the EVAP committee, the Expert Vaccine Allocation Committee, is still working on that. There's talking about that, but there's 8.4 million Texans who fall into that 1B category. And so there's still a lot of people who need to be vaccinated in the 1B category. And so it could be some time before that if it's 1C or 2 or whatever group is next is finalized, but certainly want to have an opportunity for everybody in 1B to be vaccinated.
All righty. And if somebody has had coronavirus, is it recommended that they get the vaccine?
Yes, it is. They can defer for up to 90 days, but if they choose not to defer, if they're in that 1A or 1B category, they certainly need to be recovered from that their episode of COVID-19 and out of any isolation or quarantine. And then if they receive their a monoclonal antibody infusion, then they'd certainly need to wait at least 90 days.
All righty, you answered my next question also. I think we're good.
Thank you, Aaron. Let's now go back to, I think this is going to be Kevin Welch of KFDA News Channel 10. Kevin, how are you?
Casey, can you tell us a little bit, just in general, the traffic trend at the drive-through testing site?
I think it stayed, steady. It hasn't been heavy, but it stayed, fairly steady.
Okay. And Dr. Lamintier, last week, did you say that you were able to close some of your remote ICUs?
That's correct. We had expanded intensive care services to a number of units that were smaller, that could be contained, that were able to provide intensive care services out of the need to do so. And we've been able to close those as our overall COVID census has been declining. We still are outside of the historical ICU proper because of the 30 beds in our historical intermediate care unit that we had to convert to ICU beds. So we have a capacity now of 78 ICU beds rather than what we were really expanded to, which was about 94 beds with those satellite areas.
Were those satellite areas, was that outside the BSA main hospital proper?
No, I'm sorry. It was absolutely within the walls of the hospital, but outside of the historical ICU beds as we know them in our facility. So that's what I mean by the satellites, but definitely within the walls of the hospital.
Okay. And Casey, can you tell us a little bit about how the shot clinic is funded? The personnel
Yes.
and equipment, things like that.
Sure. So that is funded through, the CARES dollars, the public health funding through our RAC nurses are provided by the RAC. So kind of a number of funding sources there. The syringes that we purchased that we're using, those were purchased but through the CARES Act dollars last year. So just a number of different funding sources.
Okay, thank you. And also, will the clinic stay open for second doses even if you run out of first doses, but you still have second ones left?
Yes, absolutely. So we're counting at the door. We have a mechanism to count, and so we'll certainly stay open for second doses, even if we run out of we'll stay open for second doses, even if we run out of first doses. So stay tuned to AmarilloAlerts.com because we'll change those indicators as our stock is available. And then as we get additional stock in, then we'll certainly change that and make sure that we're able to give vaccine accordingly.
I see. And Dr. Milton, have you heard some people starting to talk about recommending double masking, but to protect against the more virulent strains?
No, I have not heard people talking about double masking.
Okay. All right, then that's everything. Thank you all.
Thank you, Kevin. Those are all the questions we had for our media today. This concludes our news conference for today. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to thank all of our panel members who took the time out today to provide this information to the community. Once again, we do these every Wednesday at 11 a.m. and we will see everybody next week.